Akriti Srivastava with Daycare Owl. I'm here with Jordan Silverman from Daycare Insurance Services. Jordan, could you please tell us a little bit about yourself and what you do?
Yeah, thanks, Akriti, for having me. I really appreciate it. Obviously, right now is a very tough time, so any information that I can help provide to the childcare providers in our industry, I want to help do that. So, as you mentioned, my name is Jordan Silverman. I am the president of DC Insurance Services Insurance here in Encino, California. We specialize in insurance for in-home childcares as well as commercial childcare facilities and enrichment programs. We've been doing this since 1990, and all we do is childcare. So we know the industry inside and out, especially as it pertains to insurance.
Thank you, Jordan, so much for being with us. Jordan, you're kind of at the forefront of this with a lot of providers. Could you please tell us the types of call you're getting and the types of information providers are asking you for?
Yeah, so obviously, right now, the biggest thing is loss of income. Providers want to know if their insurance is going to cover them in the event that they are closed right now or the event that they have a closure. They want to know if they are going to have coverage for the money that they basically would have made had they been open. And I think that this is a very fair question because this type of coverage, in theory, does exist. Business interruption coverage, loss of income, loss of tuition coverage is a coverage that exists in the world. This coverage is typically an optional coverage available on property policies. So this is something that you would get offered if you were purchasing insurance to cover your building, or if you're purchasing business personal property insurance. Now, unfortunately, even if someone did purchase this coverage, there are exclusions to this coverage, just like there are with any insurance that exists in the world. And unfortunately, the issue of a pandemic is included in the exclusion under what's called civil authority. And that covers bacteria, virus, mold, and some other things. So unfortunately, it's something that the insurance companies have thought about ahead of time, and unfortunately, it's not something anyone would have ever thought, to ask about or to look into in the future. It's never something that anyone would have expected to happen.
I mean,
The
this is
bottom line.
yeah, I'm sorry. This is just completely unprecedented, and I
Yes.
don't think I don't think anyone is looking to blame here. There's no way the insurance companies could bail out everyone, but
Right.
I think what you're saying is that don't depend on your insurance policies to kind of bail you out on this.
Yeah, that's exactly what I'm saying. Now, there are a couple of, I guess, silver linings that are going to happen. So, as of right now, in the state of New York, the mayor there has required all insurers to send out what's called an explanation of benefits to all people that have a loss of income policy. And the intention of this explanation of benefits is to basically clearly outline exactly what they're covering, what they're not covering, why they're not covering it, in a little bit more of a user-friendly fashion than go grab your policy and read through the 15 pages that this policy is, so to speak. So that's one thing that has yet to happen here, but I do expect that to be a national thing here in the coming weeks. And then, the other silver lining obviously won't help us right now, but because this has happened, I'm sure that this will, spark some conversations that we have to have in the insurance industry, especially in this class of business on, in the future, is this some type of coverage that we can offer? Is this something that we can package in with policies? But, I've been doing this, this business has been in my family since forever, and I personally have been doing it since 2007, and never in any of my years has anyone even asked me, or has it ever even come up to where what would happen if childcares all across the country had to close because of a pandemic.
again, this is just unpredictable. And the issue most providers are facing, I mean, unfortunately, it took an event like this for people to realize that childcare providers are essential workers,
Hmm.
critical to the economy. And the issue most daycares are facing is with the quarantine orders and the school closures, most parents are at home and they are pulling out their children. So, it's not necessarily that facilities aren't safe enough. The government has said we can declare, oh, they stay open, but this has essentially allowed a lot of parents to say, well, hey, you're open, or and they're not paying the facilities, but facilities are virtually sitting empty, and no one is making any funds. And a lot of daycares are going to be headed towards the unemployment office. A lot of them are sole proprietorship and don't even file into EDD, and they have no idea what their next step is. What can you tell a daycare that doesn't have insurance, that is a sole proprietorship that's about to go under? Where can they go? What resources can they find?
Unfortunately, Akriti, at this time, because it is so unprecedented, it's kind of a day by day thing. We're staying in close contact with the insurance companies that we work with, as well as the California Department of Insurance, and we are waiting for updates from the carriers, from the Department of Insurance, on what type of resources may become available to childcare providers. In the event that any information we receive, whether it be from our insurance carrier or whether it be from the California Department of Insurance, we will absolutely update our website with that information and or send out email blasts to all of our providers, making sure that they have the most up-to-date and accurate information about resources that they may be able to take advantage of.
Thank you so much, Jordan. And obviously, a lot of parents are still on salary, and we know this is not true for everyone. We know a lot of people have this as an unprecedented circumstance for everyone, but we know a lot of parents are still on salary and able to get a paycheck. Um, should these be parents who are still supporting the daycares, even if they're not currently enrolled? And what would the collapse of childcare in this country mean for our future growth and how we bounce back from this thing?
That's a very good question, and I think right now a lot of in social media and the media that you're seeing this theme of people wanting everyone to come together to practice social distancing and to do everyone's part in order to stop the spread of this virus. But unfortunately, along with that needs to come, hey, we need to rally together as a community to make sure that our infrastructure doesn't completely collapse, because parents have to realize, hey, if we don't keep these childcare businesses afloat, then that's going to set off a whole nother domino effect that's going to eventually put more strain back onto the state and onto the education system, more strain back onto the parents, and we could very well end up with a situation where there ends up being a very serious shortage of childcare in the state, in the country. And where will we be if parents have nowhere to take their children? Of course, the big issue that this is really presenting is that startup costs for childcare are very high.
Mhm.
And if a childcare does go under, the likelihood of that childcare being able to come back and front the cost to be able to, after this is over, that may not be likely. So, we have to we have to rally together as a community and support our childcare providers to make sure that infrastructure is still there when parents will need it, when ultimately this is over, and it will come to an end. And parents don't want to be put in a situation where they have nowhere to go after that.
Exactly. We talk about social movements all the time. It's so easy to throw up a hashtag, but this is the real time to pay it forward. Paying your childcare facility will not only allow them to keep the roof over their head, as most childcare providers do live in their businesses, but it will also allow them to keep paying their employees. And providers should also pay it forward. This is how we bounce back and stop childcare rates from soaring out of control when our economy is kind of ready. Um, Jordan, I do have one more question for you. Have you heard about any providers being taken to court? Uh, due to infection. We've heard of providers being told by parents and other facilities. There's a lot of misinformation floating around.
Yes.
But
Yeah.
we've been told that they can be sued if COVID-19 turns up in their daycare.
Yeah, that's a very good question, and the answer to that is theoretically yes. They can be sued in the event that COVID-19 shows up in their daycare if, in fact, the provider was negligent in some way, shape, or form, or if the person bringing the lawsuit is alleging that the provider was negligent in some way, shape, or form. So, in if someone were to contract COVID-19 in a child care and they were alleging that the provider knew about it or that the provider did not do enough to protect against it, then yes, they could be sued. Now, in that case, that's a liability issue. And when it comes to liability, that is something that providers would theoretically have coverage for under their policy. Now, obviously, I can't say for sure in every single situation, yes, they will have coverage for that, but the liability portion is the main reason why childcare providers purchase insurance, and that is something that would be available to them, provided the circumstances around the situation were there.
Awesome. Thank you so much for your time, Jordan. We do have some best practices on our Facebook page on at Daycare. Please do go look them up that we've put together from professionals and former CDC experts for best practices to handle COVID-19, including an EPA list of products that are safe to use against it. Jordan, if providers need more information, or even if, let me ask you this, are you guys still even writing policies right now?
Yeah, that's a good question. Yes, we are still writing policies, and obviously we want to do our part, to help stop the spread of this virus. But so our office hours may be limited from time to time, but we are remaining available to help people remotely during regular business hours. So if any clients are unable to reach us via phone, they can always email us at info@dcins.com and ask any questions they might have. I personally, myself, will be jumping in to answer some of those questions as well as some of my staff. So we absolutely encourage providers, if they have any questions at all, to reach out to us there, and also just to be aware that any new information that we get, we will absolutely disseminate it to them via email or via our website.
Jordan, thank you again for your time. You and I have had the privilege of working together a few times. It's always a pleasure. It's always a pleasure speaking with you. You give the most accurate information. Again, this is DC Insurance Services. Please go look them up. And if you have any questions, please email us. Thank you, Jordan, for your time.
Thank you, Akarji. I appreciate it.